Patient has a couple things going on. She's got a pretty significant bunion. So you can see this big bump right here, and this toe is going that way and is rubbing against this toe. She also has arthritis. So you can see this bump right here on the top of the foot that kind of goes like this. This is an arthritic joint in combination with a bunion here. You can see this prominent bone on the inside of the foot there. We're going to be smoothing that down. And you can see how the big toe is kind of turning towards the second toe. We're going to be making a cut in the toe bone that's going to allow me to rotate the bone the other direction and off of the adjacent second toe. And you can actually see what that allows me to do is I can push the bone over with that osteotomy. So it allows me to correct the bunion by pushing that over. And now the first toe here and the second toe here are now parallel to one another. This is what I love about minimally invasive surgery. This was a poke, this was a poke, that was a poke. We had another little poke right there. Patient is good and healed, the bump is gone, the big toe is no longer touching the second toe. Overall, do you mind telling us, how was the surgery experience?
Much better than I anticipated. I always have doubts when it comes to surgery, but it was wonderful. I really didn't have much problem, just a little bit more pain in the second and third week. First week, not much pain. I think, the nerves hadn't woken up. So the second, third week, I had more pain. But after that, it was really smooth sailing. So very good.
And you were walking and driving right after surgery? Mm-hmm. Fantastic. Can you wiggle your toes? Any pain?
No pain whatsoever.
Any pain when I press?
Nope.
Fantastic.